Hi friends, I'm John Laspina. I'm the carnivore teacher, and I'm not going to talk about carnivore per se in this video. I'm going to talk about insurance and doctors and healthcare, because I recently watched a podcast with Dr. Sean Baker. He had on the CEO of Crowd Health, and I listened to the podcast 2 more times because it really made a lot of sense. My healthcare is going up about $100 a year. $100 a year. And I kind of brushed it aside and thought, well, that's the way it is. We all have to pay healthcare. It stinks in this country, but what are you going to do? What's the alternative? You have to have healthcare insurance, right? Well, you don't if you have Crowd Health. So I want to read to you, kind of like a book on tape, if you want to listen to this in the car or while you're exercising or doing chores. I want to read to you what this Crowd Health is. I believe in it so much that I dropped my healthcare plan and I joined Crowd Health. And I'm saving over $700 a month just by doing that. So I'm going to read to you from their actual Crowd Health explanation on their website. What is Crowd Health? Finding and funding the healthcare you need shouldn't feel isolating or overwhelming. So together with members, Crowd Health is changing your healthcare experience. Your Crowd Health membership provides you a platform, community, and toolkit to help you find and fund your healthcare outside the insurance system with personalized support along the way. As a Crowd Health member, you participate in the healthcare system as a self-pay patient, cutting out the health insurance middleman. While you maintain the ultimate responsibility for paying your own medical bills, you can expect to pay for the smaller expenses on your own and to submit your larger medical expenses to the Crowd Health for funding. In turn, you'll be invited to help crowdfund other members' larger medical expenses too. At Crowd Health, members have access to lower medical costs through the power of consumerism and self-pay while avoiding outrageous health insurance premiums, deductibles, and out-of-pocket maximums. With Crowd Health, you can save thousands of dollars every year while experiencing real healthcare freedom. So Crowd Health is a caring community. You're not alone. Crowd Health is building a crowd of people like you, savvy, generous, and responsible, to support one another in accessing and paying for health care. Your Care Advocate provides caring, personalized support throughout your healthcare journey, like finding fairly priced, high-quality care options while guiding you through the administration and logistics of the healthcare system. Crowd Health is access to care. Crowd Health helps you access the care you need when you need it. Crowd Health offers access to a robust virtual care platform available 24/7 through the app. They can help you find quality, cash pay friendly care in your area, or if you've already got a favorite doctor, that's great too. There are no doctor networks to limit you here, just a request that all members shop smart for their care. And your membership gets you access to discounted prescription pricing, all at your fingertips through the Crowd Health mobile app. Crowd Health is crowdfunding. Each month, members pay a membership fee to be part of the crowd and commit to helping crowdfund their fellow members' bills when asked. As health expenses from members arise, Crowd Health communicates these needs among the crowd. Then, Crowd Health facilitates the crowdfunding of expenses by inviting members to voluntarily give to help fund the medical bills of other members. So who is Crowd Health? The power of Crowd Health is our vibrant, health-conscious, and generous group of members, aka the crowd. Together, we're achieving something bigger, better, and altogether different than if we tackled the complexity and unaffordability of healthcare costs alone. Our members are savvy and generous, like-minded and health-aware, responsible and accountable. If that's you, you're really going to like it here. On the flip side, if you're looking for a way to work the system and mooch off of others without being generous yourself, keep looking. You'll be out of place in Crowd Health. The crowd comprises members from babies through age 64 who provide biometric values and health history information upon joining. The crowd welcomes members with varied health histories while giving transparent, specific terms for how care for previously documented or diagnosed conditions are funded. All these details are in place so members can be confident about who and what your dollars are funding. Savvy and generous. You've probably joined the crowd because you've been failed by the legacy health insurance system and are tired of paying too much for your health care. As a savvy member, you're looking for the best service at a great price and are too smart to be fooled by healthcare players who don't have your best interest in mind. Through your generosity, you keep up with your monthly commitment to help fund healthcare for the crowd. When you need help with your bills, your fellow generous members will help fund your care too. Crowd Health uses generosity scores and health cost ratings to operate in a transparent way. Your generosity score reflects your crowdfunding activity, while your healthcare cost ratings show how reasonable the prices are for the care you receive. Like-minded and health-aware. Crowd Health members have like minds in seeking something trustworthy, simplified, and freeing, a new solution that is changing the game and is bigger than fighting for healthcare freedom on your own. And by being health-aware, you know that staying engaged with your own health helps not just you, but the crowd as a whole, too. Responsible and accountable. Crowd Health members are responsible and accountable to each other, which lets us care abundantly for each other. That's good news for all of us. To help the entire crowd thrive, you and your fellow members can count on one another to ensure that your membership fee is paid in a timely and consistent manner, participate when asked to crowdfund fellow members' bills, trust that you can get the best care without paying the highest price, and be willing to choose high-quality clinicians near or who charge responsible and fair prices. Only submit legitimate, medically necessary bills for crowdfunding. Care about your own health and that of the people around you, proactively engaging with your health and spending wisely on your own health care. Trust the crowd to help fund your health expenses while understanding that ultimately each member is responsible for your own medical bills. They are so glad that I joined, and they will be very happy when you joined. And I think you'll be happy if you join too. The crowd is better with all of us in it. Crowd Health's guiding principles. So Crowd Health is founded and run by people who think and feel like you. Healthcare can feel complex, expensive, and lonely. So they've reimagined a different solution with you and me in mind, embracing the guiding principle of simplicity, affordability, community, and quality. Simplicity, no more health plan confusion. The fine print of insurance plans, in-network versus out-of-network coverages, deductibles, co-payments, and out-of-pocket maximums is confusing and frustrating. And that's why Crowd Health is committed to simplicity in each experience for every member with 3 simple steps. Step 1, let Crowd Health know about a new health event and or upcoming medical visit, and let them help you navigate care before scheduled or expensive procedures. 2, fund the first $500, aka your membership commitment of each health event yourself. And 3, upload medical bills and receipts through the app and let Crowd Health submit your eligible expenses over $500 per event to the crowd for funding. Technology that works for us. When we start our healthcare journey through Crowd Health app, we get the most from our membership, the best value, the simplest payment process, and the support of care advocates who are here to walk us from scheduling to bill payment and everything in between. It's quick, simple funding. Through Crowd Health's smooth digital process, crowdfunding by the member community happens fast, making things easier both for members and for the clinicians who provide your care. They strive to send eligible crowdfunding requests to the crowd as soon as reasonably possible. Members have 3 days to approve or deny each request. Crowd Health will promptly transfer approved funding requests to the receiving member's crowdfunding account. Affordability, helping the crowd save money. Healthcare can be incredibly expensive, but here the crowd is built on commitment to affordability and the belief that the best care doesn't have to be the priciest. That means you use the power of consumerism. Members participate in the healthcare system as self-pay patients. This lets you access high-quality care for less than the insurance sticker price. The members regularly benefit from self-pay discounts ranging from 25 to 85% of the normal billed charges. They use the power of negotiation. They leverage relationships with providers to offer pre-negotiated and bundled pricing options for our scheduled care. And when we face an unexpected health event and a big bill comes with it, Crowd Health and their partners can step in on behalf of us and the crowd to negotiate it down to a fair price. Community transforming healthcare together. Crowd Health is built by people who care, for people who care. As a member, you and I are the crowd, and we are building the future. You want to be part of a new solution that gives you and your family a totally different experience, not marginally better option than the health insurance you had before. With you and the crowd, they're building a better future and transforming healthcare as we all grow. We have powers in numbers too. The problems of the American healthcare system is unfair pricing, hidden billing practices, mismatched incentives between patients and insurers. They're all too big for us to take on alone. But with Crowd Health, we're joining forces with members and a team who are taking on the broken system with us. So we're not alone. Navigating your health shouldn't leave you feeling like you don't know who you can trust. With Crowd Health, your health journeys happen within a transparent, trustworthy community you can count on. You get quality. Only the best for you. Support isn't a buzzword, and you deserve the best. With personalized care navigation provided by a team member care advocates, they mean it when they say it. You'll have a high-quality member experience you love. No doctor networks, seriously. Crowd Health does not limit your access to care through stifling doctor networks. You can keep seeing your favorite doctor or talk to a care advocate if you need to help finding a new high-quality provider. In the best interest of the crowd, members allow healthcare to navigate planned procedures whenever possible to high-quality, cash-pay-friendly doctors, which saves money for you and your fellow members. Healthcare is freedom. At Crowd Health, you're free to get the care you need when you need it without feeling locked into a burdensome insurance plan. Technology that's always improving. They're building the best app and resources to make your life easier, and it just keeps getting easier. Now, how Crowd Health works. It's not health insurance, and why that's a good thing. One of the biggest questions that they get is, how is Crowd Health so much cheaper than other health insurance? And the answer is simple. Crowd Health isn't health insurance. It's a platform community and toolkit to help you find and fund your healthcare outside the insurance system, including a healthcare crowdfunding platform for your big bills. This means your membership is designed and funded differently than health insurance, and that Crowd Health has different priorities, like putting you, the member, first. They have developed systems and processes that allow the community to fund medical expenses. However, your membership is not insurance, and therefore Crowd Health cannot guarantee that your medical bills will be funded. Ultimately, members are responsible for their own medical bills. What members pay. Membership fee payments and monthly crowdfunding requests. Compared to painfully expensive insurance premiums, Crowd Health members pay a low monthly membership fee to be a part of the crowd and commit to helping fund other members' medical bills each month. Membership fee amounts are the same for everyone, and monthly crowdfunding maximums are different based upon anticipated healthcare needs of certain age groups, and here's how it breaks down. So members from age 0 to age 54, you pay as a subscription fee $50 a month. Then you will be asked no more than one time a month for no more than $135 to help crowdfund somebody's surgery or incident or health need. So the member commitment is that you must pay the first $500 for a major health event before expenses are eligible for funding by the community. That's ages 0 to 54. Now, if you're age 55 through 64, that's me, my subscription fee is $50 a month. For crowdfunding, I will be asked no more than $270 a month on only one time to help fund somebody else's medical expense. And for an example, last month I paid my $50 dues, and they only asked me for $140 to help fund somebody's, I don't know if it was a pregnancy or something, but they specifically tell you what it's for. You pay it because it's way less than your healthcare bill would have been. Now, again, $500, if you have a major unique health event, you will pay the first $500, and Crowd Health will crowdfund however much you need above the $500. So if you have a surgery that's $25,000, you only pay $500. Now, if you're a family of 4 or more and you'd like to have Crowd Health, you pay a $50 subscription fee a month, and then they will ask you for $405 a month, maybe no more than $405. They may ask you for less or none that month, depending on the needs of other people. Again, it's $500 that you must pay for a severe event for expenses that are eligible for funding by the community, the first $500, and then they will pay everything else. More about crowdfunding. The maximum monthly crowdfunding amounts listed that I just talked about are not fixed and can be adjusted based on the actual spending of you and the crowd. If you and the crowd spend less in a given month, your total monthly crowdfunding request may be lower. And it is. Making healthy and smart spending choice benefits both you and the whole crowd together. When you or someone in your family turns 55, the maximum crowdfunding amount will increase to $270. I'm in that bracket right now, on the first billing date following the birthday. If you are 64 years old, they're going to be in touch with you before the next birthday about transitioning out of Crowd Health. Your membership ends when you turn 65, and they're working on possibly extending this past 65, but as of right now, because of Medicare, it ends at 65. Transparency in crowdfunding. Your monthly membership fee must be paid to be a member, but choosing to help other members pay their medical bills is voluntary. To help you understand who and what you're being asked to fund, each member receives a generosity score, and each crowdfunding expense receives a health cost score. These factors determine whether a crowdfunding request is rated green or red. The member generosity scoring. Member generosity scores are calculated based on the amount a member has given in crowdfunding compared to the total amount they have been asked to give. If you agree to fund 100% of the fair-priced crowdfunding request you receive, you will maintain a 100% generosity score. If you choose not to participate in funding other members' fair-priced bills, your generosity score will be affected by the proportion of what was requested of you versus what you gave. If you cancel your Crowd Health membership and decide to rejoin later, your previous generosity score will carry over to your new membership. A generosity score of less than 90% will lead to a red rating of your crowdfunding request. Health cost scoring. Crowd Health's pre-negotiation and navigation services help members access quality care and ensure that crowdfunding requests reflect reasonable cash pay pricing. If you need a surgery or other scheduled procedure, treatment, or diagnostic, including labs and imaging, they can compare estimates from other providers and offer competitive rates for high-quality care. If you pick a provider that charges more than 120% of the fair market price of the treatment or procedure, the expenses will receive a poor health cost score and lead to a red rating of your crowdfunding request. Please note that health cost scoring applies to not just large expense planned procedures, but also to smaller expenses like labs and imaging. Please contact your care advocate before having any scheduled diagnostic, lab, imaging, or other planned tests done, and they will gladly connect you with a discount voucher for the same service in your area. Failure to notify Crowd Health before costs are over 120% of the discounted options are incurred will result in a red rating of these bills. Staying green. The following factors contribute to a green crowdfunding request rating. The requesting member has a generosity score of 90% or above. Health costs for the request are within 120% of fair market rates considering factors like 1. Previously crowdfunded procedures in the member's regional market within the last year. 2. Third-party partners securing a single case agreement, SCA, cash pay bundle or discount voucher. 3, no alternatives within 50 miles of home zip code for procedures under $25,000. 4, no alternatives within 1,000 miles of home zip code for procedures equaling to be or more than $25,000. 5, medically urgent, critically time-sensitive, or emergency event. Or 6, extenuating circumstances. In the case of travel to a provider navigated by Crowd Health, all travel expenses, including airfare, rental, car mileage, hotel, and food, are eligible to be submitted to the Crowd. If you are a generous member and your Crowd Health score costs are in line with fair market rates, your crowdfunding request will be rated green, which tells your fellow Crowd members they can have peace of mind in funding your request. Avoid red. Reasons an excuse may receive a red score include the requesting member has a generosity score below 90%, price is more than 120% of the fair market rates when compared to other options identified by Crowd Health, choosing a non-medically necessary option for care without demonstrably better patient outcomes in comparison to other options for treatment as determined by a third-party clinical review, failure to take advantage of negotiated discounts such as due to member negligence or unresponsiveness, paying inflated prices for care through an insurance plan or toward a deductible, or failing to cooperate with Crowd Health in the negotiation of medical bills or failing to comply with negotiated payment terms. If you are not generous to other members in need, or your healthcare costs are out of line with fair market rates, your crowdfunding request may be rated red, which may cause fellow Crowd members to hesitate in funding your request. Members will not be penalized for denying crowdfunding requests rated red. Crowdfunding request settings. Most members choose to help with every green crowdfunding request, which makes things easy and keeps your member generosity score at 100%. The default settings for crowdfunding are to automatically approve green requests and to automatically deny red requests. You may automate this setting during your sign-up or contact the help desk to change your setting at any time. If you choose to manually review crowdfunding requests when you receive a crowdfunding request, you may approve or decline by responding directly to that request. Members have 3 days to respond to a request. After 3 days, requests are automatically approved. When you approve a crowdfunding request, your payment method on file will be charged for the approved amount. Family memberships. Family memberships are available for families with 4 or more members. To be eligible for a family membership, you must meet at least one of these conditions. A parent under age 65 with 3 or more children by legal and or blood relation who are under the age of 26. 2 parents domiciled together under age 65 or 2 or more children by legal and or blood relation who are under age 26. Or a group of 4 or more siblings by legal and or blood relation who are under the age of 26. Member commitments instead of deductibles. The Crowd exists without the burden of an annual health insurance deductible. Insurance deductibles can mean you pay $3,000, $5,000, or even $10,000 or more in health expenses for your family on top of those high monthly premiums before your coverage kicks in at all. After your deductible is met for the year, you may continue to pay a percentage of the cost up to and out-of-pocket maximums that are much higher than your deductible. Ouch. Crowd Health is different. Your membership means you commit to your fellow Crowd members that you'll pay your $500 member commitment for each valid health event, and they will ask the Crowd to fund the rest of the eligible expenses. There is no maximum limit to the amount of bills you can submit for crowdfunding as a Crowd Health member. So, what do you mean by health event? A health event is any unique health scenario that comes up for a member and includes all the expenses related to it. It could be something big like knee surgery, which might entail doctor's visits, the surgery itself including physician's fees, facility, anesthesia, physical therapy, and pain meds, or something minor like one of your kids needing to see the pediatrician for a sore throat. With each valid health event, members pay the first $500 as your member commitment. For many health events, your bills will total much less than $500. For example, a standard doctor's visit and prescription are likely to cost you less than $200 for an event. But for larger events, like the knee surgery example and above, you'll pay the initial $500, and all valid expenses over your member commitment will be submitted to the crowd for funding. For health events lasting longer than 12 months, starting with the original date of service for the visits and the bills in the event, the $500 initial member commitment will reset in the 13th month. So here's Crowd Health's commitment to revenue transparency. Some of the main factors in rising healthcare costs are the mismatched incentives built into the system's financial structure. Health insurance companies profit off of a percentage of customer premiums so they can make more money by hiking up prices. Crowd Health is different. They have intentionally established their revenue to align with their incentives 100% with the goals of the crowd, and they're committed to being transparent about it. Crowd Health receives revenue from members' monthly membership fees. Since Crowd Health doesn't make money as a percentage of crowdfunding, they have no interest in denying the crowdfunding of members' bills to increase their profits. They are there to help you and the crowd save always. So using your membership basics, membership accounts and crowdfunding bank accounts. Crowd Health primary members will have both a membership account and a crowdfunding account in order to be an active member of Crowd Health. Your membership account involves the information you enter during the online sign-up process. Your crowdfunding bank account is an FDIC-insured bank account that ensures the sending and receiving of crowd-funded monies between member crowdfunding accounts and for the payment of healthcare services. Getting oriented. Because Crowd Health is different, they want to make sure members understand the tools that help you navigate your healthcare without insurance. To help you get the most out of your membership, Crowd Health requires the primary member to complete a short new member orientation video and quiz, notifying them of your events. For your healthcare to be eligible for funding by the crowd after your $500 membership commitment is met, except for unscheduled, urgent, or emergency care, you must initiate your health events through the Crowd Health mobile app or member portal. You do so by creating a health event that reflects the member involved and the type of event, or by contacting a care advocate via email or using the Crowd Health mobile app. A care advocate will assist you and gather additional information to help you through your health event. Members should initiate all planned care through the platform regardless of whether it is expected to exceed the $500 member commitment. That way your bill payment process is kept simple and your care advocate can support you along the way. Even if you need care that isn't eligible for crowdfunding, they can help navigate you to fair prices and high quality care. If multiple members of your family are involved in the same health event, like both kids getting the flu the same week, hang in there, you'll need to log separate visits to open separate health events for each person, and each person's care will be subject to a separate $500 member commitment. So, choosing your doctor. Crowd Health does not participate in a provider network. You can see your existing doctors or let your care advocate know if you need help finding a new one. For your health care to be eligible for crowdfunding, it must be performed by a licensed or board-certified practitioner. To uphold the integrity of the crowdfunding process on behalf of the crowd, members should not knowingly or repeatedly visit a medical practitioner who is unreasonable or unfair in their billing rates and practices. Submitting your bills and receipts. When you receive a bill, scan it into the Crowd Health app and attach it to your health event. If your bill needs to be negotiated, they'll coordinate with the partners to help you get the best discounts. Once your bill has been paid, attach the corresponding receipt or proof of payment in the app, and they will review and submit the approved bills for crowdfunding quickly and easily. Handling big bills. The crowdfunding platform is designed to maximize the probability that all members' eligible bills can be fully crowdfunded. For big planned expenses like surgeries, Crowd Health can pre-negotiate the cost to a 30 to 80% discount before the procedure even happens. Always contact your care advocate before a scheduled surgery to allow time for this negotiation. For emergency expenses, Crowd Health provides specialized post-negotiation support to work down balances before they are paid, sometimes up to 95% off. Contact the member care team before you pay a big bill for emergency care so they can help you. The online platform and mobile app access. As soon as you sign up for your Crowd Health membership, you can download and log into the Crowd Health mobile app and will be able to access your member portal through the website. Because the app and portal contain information and tools that are reserved for active and oriented members, you will not be able to utilize the full app functionality until your membership start date. Please note that without access to the app via a smart device, you will not be able to utilize certain features of your Crowd Health membership. If you have any questions or issues with logging in or accessing the member portal or a Crowd Health member app, you can email them at hey@joincrowdhealth.com. Self-pay patient status. Crowd Health isn't insurance, so you do not have an ID card, member number, or benefits group to submit on patient intake or other insurance type forms. At any medical visit, you'll just indicate that you are an uninsured or a self-pay patient. Health event specifics. Virtual care. Because the Crowd cares about your well-being and wants to encourage access to high-quality healthcare when you need it, virtual visits, including services like virtual urgent care, virtual primary care, and virtual talk therapy, including team talk therapy, through the Crowd Health platform are part of your membership. For virtual primary care and virtual urgent care, payment is required at the time of service, and these visits are fully fundable once you submit your receipt. For virtual talk therapy, there is no upfront payment required. Crowd Health will automatically generate a crowdfunding request for your virtual talk therapy visits. Annual wellness. Crowd Health members can submit up to $300 for one basic wellness event per year to be crowdfunded. This wellness event can be utilized for any one of the following, performed by a licensed or board-certified practitioner. Primary care wellness exam, physical including naturopathy from a qualified practitioner, pediatric well care visits, direct primary care membership fee, annual female gynecological exam and labs, dental exam including cleaning and x-rays, or vision exam and corrective lenses. The Crowd waives the $500 member commitment for one annual wellness event per member, ages 3 and over. Annual wellness spending beyond this $300 crowdfunding threshold will be funded by the member. Please note that if after a basic wellness event your doctor orders specialized diagnostics, imaging, additional lab work, or other follow-up care related to a new concern or acute condition identified at your wellness visit, that will initiate a new separate health event and will be subject to the $500 member commitment. Certain other preventative care, such as colonoscopies and mammograms, are valid health events and are separate from the basic wellness event described above. Expenses related to these wellness events can be navigated by your care advocate and submitted for crowdfunding when the $500 member commitment has been met. Beyond these specific diagnostics and the single annual wellness visit benefit, all other preventative care is the full responsibility of the member and is not eligible for crowdfunding. Talk to your care advocate about how to make the most of your annual wellness benefit. Your wellness visit must be completed by December 31st to apply for that calendar year. Given the frequency of recommended well checks for the littlest members, health events for newborn and children's wellness are treated differently up to 3 years of age. Scheduled non-emergency care. For all non-emergency care, you will log your visits through the mobile app or mobile portal before you go, which lets your care advocate give you personalized care and support throughout the process. For minor appointments, notify your doctor that you are a self-pay patient and pay the doctor at the time of your visit. If your doctor requests labs, imaging, and other follow-up care, please get the orders from your doctor at your appointment and send them to your care advocate, who can help you navigate the next steps with high-quality care and fair pricing. For major non-emergency care, such as a scheduled surgery, please contact a care advocate in advance. To navigate potentially expensive and/or complex health events on behalf of the Crowd, Healthcare may engage a trusted third party to provide clinical review and/or pre-navigation services for procedures and treatments. A failure to notify Crowd Health before your scheduled health event, which prevents Crowd Health from performing appropriate due diligence and fair price comparison, may impact your health cost score or eligibility for funding. Now, emergency and urgent care. For all unplanned urgent or emergency care, inform your care advocate as soon as possible about the health event so they can guide you through your health journey and offer you the best member support possible. When receiving urgent or emergency care, state that you are a self-pay patient and ask to be billed after your care. Crowd Health can facilitate negotiation on your behalf for emergency room bills before you pay them. Prescriptions. For your prescriptions to be eligible for crowdfunding, you must use your prescription discount when purchasing. You will show your RX discount card, accessible through your member profile in your app, at the pharmacy to get the best price, pay at checkout, and submit the prescription receipt through the app for crowdfunding. Prescription drug costs eligible for crowdfunding are generally limited to a 120-day supply per valid health event. Children's immunizations. For all children's immunizations, you must use a Vaccines for Children's VFC provider for any related expenses to be eligible for funding as part of the valid health event. How it all comes together. To help you get a clearer idea of the member experience, below is an example to walk you through the process. Family of 4, 2 parents in their 30s and a toddler and an elementary schooler, pays $50 per person each month to be part of the crowd. This month, their crowdfunding request totaled $322, meaning they're spending $522 to be part of the crowd and saving over $900 compared to the $1,500 in health insurance premiums they were paying before, in addition to satisfying large deductibles before their coverage kicked in, plus ongoing copays and expensive coinsurance. Yuck. Here's what navigating a health event looks like for those members. The family ventures out for a hike one Saturday morning and Dad takes a bad fall and hurts his knee. He's in a good bit of pain, but it's not an emergency and it's the weekend. Conveniently, he opens the Crowd Health app, logs a new health event, and requests a virtual urgent care appointment. The virtual doctor is available fast, and between a video evaluation and listening to Dad describe his symptoms, diagnoses a sprain. The doctor writes a prescription for the pain medication, so Dad goes to his neighborhood pharmacy and uses the Crowd Health prescription discount tool to get a great price. He shows his digital RX card and pays for the prescription at checkout. The virtual doc also recommends a follow-up appointment in person, so Dad contacts a Crowd Healthcare advocate who helps him find a high-quality, fairly priced orthopedist in his area. When Dad arrives at his appointment, he lets them know he's a self-pay patient and pays for his visit at checkout. Dad's knee is starting to feel better as the swelling goes down, but the orthopedist says he'll need a few sessions of physical therapy to be back to 100%. Dad gets a referral from his doctor for a highly regarded PT and calls the office to ask for a cash pay estimate before he schedules. He sends the pricing to the care advocate, who confirms it's a reasonable price for his care, then schedules the appointments he needs. 4 weeks later, he's done with physical therapy and his knee is feeling great. He has scanned in the receipts for his prescription, orthopedist visits, and physical therapy sessions in the Crowd Health app. His bills totaled $725 for the health event, so $225, the event-related expenses beyond his initial $500 membership commitment, is submitted for crowdfunding. Through the easy-to-use Crowd Health platform with support from the care advocate, and thanks to the generous member community, Dad got the quality care he needed right when he needed it. Caring abundantly. When you join the crowd, you're there for your fellow members in their time of need. And when you help crowdfund other members' expenses each month, you're supporting the very people who will step up for you when you have your own health events. We call it caring abundantly, and we believe it's a beautiful thing. When we each give a little, we find there's plenty for all. Caring for you. As a member of Crowd Health, you have access to the tools and support you need to lead the healthy, thriving lifestyle you desire. They want to see crowdfunding flourishing, so do I. meaning you receive the care and need without fear of how you'll pay for it. Crowd Health takes the guesswork out of how Crowd Health gets funded, and the exceptional care advocates are there to help you every step of the way. Caring for your family, maternity and newborn care. Member maternity care that is eligible for crowdfunding includes your whole pregnancy through your baby's birth and beyond. All 3 phases of pregnancy care, prenatal, labor and delivery, and postpartum, are represented in a single global pregnancy health event with a $3,000 member commitment. Your child's standard newborn wellness care, birth until 6 months old, is a separate health event from maternity and is an eligible health event for the baby when added as a new member after birth. If your baby gets sick or has complications at birth, the illness or injury will be treated as a separate health event from this newborn wellness health event. Please note that maternity expenses for a pregnancy with an expected delivery date less than 300 days after the mother's membership start date are not eligible for crowdfunding, and the baby cannot join the crowd until 6 months of age. Pregnancies that are in question regarding this timeline may require a third-party clinical review before they are eligible for funding. Adding children at birth. For pregnancies that are eligible for crowdfunding, a new baby may be added to your membership within 30 days of joining your family for his or her health events to be eligible for funding retroactively, starting at the date of birth. For pregnancies that are not eligible for crowdfunding, a baby may be added to your membership at 6 months of age, effective at the start of the next billing cycle. Adding children for adoption. You may add an adopted child to your membership within 30 days of joining your family for health expenses to be eligible for funding retroactively, starting at the child's birth date or the start of your next billing cycle. Adding additional family members. The addition of family members, like children over 6 months old, spouse, etc., to a primary member's account may be initiated at any time. These added memberships will be active at the start of the next billing cycle. Children's wellness visits and vaccinations. For children conceived and born or added to a family by adoption after 1 month, parents join Crowd Health. Standard newborn wellness care, birth until 6 months old, is treated as one health event with one $500 initial member commitment. Existing children in a Crowd Health member family are eligible for membership after they turn 6 months old. For children ages 6 months until 3 years, your child's wellness checks are treated as a single health event with one $500 member commitment. Starting at age 3, your child's annual visits will be treated like basic annual member wellness events for members of any age. All illnesses or injuries will be treated as separate health events from wellness visits. Now, please note that you must utilize the Vaccines for Children VFC program or a similar community clinic vaccine discount program in order for any expense related to your child's vaccinations to be eligible for crowdfunding. And for more information on how to find a vaccine for your children's clinic in your area, you contact a care advocate. Caring for the Crowd Health community, they may still assist you in negotiating care that is not eligible for crowdfunding. Any disputes that arise related to a health event's eligibility for crowdfunding will be decided by an independent third party hired to represent the crowd. They believe you have each other's best interest in mind, and they are grateful for the caring crowd that we're building together. Now, there are excluded procedures and treatments, alternate therapies, acupuncture, chiropractic treatment, exercise programs, experimental and or unproven treatments or diagnostics such as GI mapping, thermography, colonics, some genetic screenings and testings, massage therapies, medical, marijuana, CBT, nutritional, dietary treatment or supplements, physical therapy, if not ordered by a doctor as part of a valid health event, occupational therapy, speech therapy, regenerative treatments, or complications from ineligible treatments. Holistic and naturopathic treatments must be performed by a licensed and or board-certified medical practitioner whose credentials are recognized in the state of service. Prepayments for multi-visit memberships and other treatment plans are not eligible for crowdfunding. Members should seek only the treatment necessary to treat their conditions and should submit each individual bill and payment after the time of service in order for it to be reviewed for crowdfunding. Cosmetic procedures, breast implants, hair loss treatment, weight loss programs, surgery, or other treatments, including prescriptions, etc., and any other non-medically necessary cosmetic procedures or complications from ineligible treatments. They're not funded. Mental health, ADD and ADHD, counseling, talk therapy, except for virtual talk therapy provided through the Crowd Health app, diagnostic, neuropsychological testing, psychiatric treatment, rehabilitation facilities, and expenses such as addiction and eating disorders or complications from ineligible treatments. Personally assumed risk, injuries or conditions indirectly or directly attributable to gross negligent acts, hazardous activities, under the influence of drugs or alcohol or illegal acts, injuries resulting from failure to comply with medical advice, injury from war, armed conflict, or self-inflicted injury, or complications from ineligible treatments. Hazardous activities include hazardous sporting activities, including but not limited to motorcycle racing, off-road vehicle competitions, hang gliding, parasailing, skydiving, drag racing, motocross racing, road racing, sports stunts, and mixed martial arts, MMA, lighting self on fire, swimming during a lightning storm, swimming with sharks, trying to break a world record by holding breath underwater, training aggressive predators such as tigers and lions, prostitution, walking home in the dark on a freeway, and using recreational drugs. None of this will be covered, folks. An independent third party hired to represent the crowd has the full discretionary authority to determine if any activity is considered hazardous. In the spirit of crowd health, this exclusion is not here to be a loophole for denying the crowdfunding of expenses from crowd events that result from members living active, normal lives. Rather, it's to keep people from being idiots and, say, lighting themselves on fire and diving into a pool of hungry sharks, etc., than expecting the crowd to fund it. Prescriptions, experimental drugs, high-cost therapeutics, injectable epinephrine, orphan drugs, and any other prescriptions or vaccines purchased without the crowd health discount tool or complications from ineligible treatments. Reproductive health, adoption, abortion, contraceptives, fertility, infertility treatment, impotence treatment, pregnancy, conceived before membership was active, including prenatal labor, delivery, and postpartum maternal care, congenital hereditary conditions for baby, first 6 months of infant health care or treatment for complications such as ectopic or miscarriage, gender reassignment procedures and treatments, surgical sterilization, or complications from ineligible treatments. That stuff's not covered. Vision and dental. Dental care, except as a qualifying annual wellness event, non-ophthalmologic eye care, except as a qualifying annual wellness event, or complications from ineligible treatments. Other custodial, like nurse or similar, care when not treating illness or injury, euthanasia, food or infant formula, healthcare charges incurred before you were a member, international air, ambulance, medical evacuations, late fees, or billing irregularities due to a patient's negligence, over-the-counter medicines and personal comfort devices, subacute care or skilled nursing care, and any other non-medically necessary service or treatment or complication from ineligible treatments isn't covered. Previously documented or diagnosed conditions. The crowd welcomes members with varied health backgrounds. However, there are limitations on funding health events related to conditions that have been previously documented or diagnosed. This includes conditions such as asthma, congenital conditions except for children who become crowd health members at birth, diabetes, genetic disorders, heart conditions, sleep apnea, and any other medical condition which was previously diagnosed or documented. This is not an exhaustive list. Those conditions that have been previously diagnosed or documented within 5 years of joining Crowd Health are eligible for limited funding starting in the 3rd year of membership. This includes any condition that was diagnosed symptomatic, suspected, or has required treatment. Specifically, any condition, illness, or injury that was previously diagnosed or documented is not eligible for funding in years 1 and 2 of membership, and a maximum crowdfunding limit of $25,000 per year related to these conditions applies in years 3 and following. High cholesterol and high blood pressure are not subjects to these previously diagnosed or documented condition limitations. Here's some more membership details. Since they're doing something different here, There are a few more things they want to make sure you know about Crowd Health membership. Minimal essential coverage. Since your Crowd Health membership is not insurance or health coverage, it does not satisfy any federal or state individual minimum essential coverage mandate under the Affordable Care Act, the ACA. If you live somewhere like California or DC or Massachusetts, New Jersey, Rhode Island, or Vermont with a state-level individual mandate, you are responsible for securing coverage to satisfy those mandates independently from your Crowd Health membership. If you have a mandated health plan from a state, you are expected to utilize this coverage for all eligible care before submitting bills to Crowd Health. So there's California, DC, Massachusetts, New Jersey, Rhode Island, and Vermont. Other coverage. To avoid unfairly burdening the crowd with unnecessary bills, members must pursue payment from applicable payer sources such as car insurance, MEC, workers' comp, etc., for health events before submitting any remaining medical expenses for crowd funding. If you have health insurance in addition to your Crowd Health membership, which is not health insurance, talk to a care advocate about how to be a smart consumer for your expenses. Taxes. Your monthly membership fee and all crowdfunding participation represent voluntary participation in a membership that facilitates the funding of fellow members' medical bills. These should not be considered as a health insurance premium, nor should they be considered as contributions to a healthcare sharing ministry. These amounts are not tax deductible. Please consult a tax professional for guidance on any tax-related questions. Legal action. The ability to pursue fair healthcare costs on your behalf as a self-pay patient is an important part of how Crowd Health operates and cares for the crowd. In the case that a provider bills an unfair amount and is unwilling to negotiate with Crowd Health requires members to give them the right to pursue legal action against the provider on behalf of you and the crowd. Access to your health records. When you join Crowd Health, you agree to give specific individuals at Crowd Health and the partners access to your health records upon request. In the instance of a telemedicine visit or a health event, Crowd Health may receive information such as the following from your medical practitioner: patient's name, date, time of appointment, call, outcome, diagnoses, prescriptions, etc. They reserve the right to request medical records, Crowd Health does, which are used to assist with care navigation and to protect you and the crowd by providing important context about the medical history and helping validate bills. Members are required to execute HIPAA authorizations to allow Crowd Health and other partners to access this private information. Failure to do so may deny or limit your care navigation and/or the crowdfunding of your health event. Protecting your personal information. Crowd Health understands that privacy is important to our members. As such, Crowd Health makes every attempt to keep your information, including personal health information, secure and protected. And to learn more about how they protect their information, you can email privacy@joincrowdhealth.com. In addition, for Crowd Health to provide support for many of the services, they ask members to sign HIPAA authorization forms, allowing for the release of protected health information to Crowd Health from certain medical providers. Promotion codes. If you signed up for the membership using a promotional code, all responsibilities as outlined in this membership guide still apply. Only one promotional code may be used per member. International travel policy. The terms of your Crowd Health membership only apply to urgent and emergency care outside the United States. However, please note that expenses relating to international air ambulances or medical evacuations are not eligible for crowdfunding. Clinical review. Crowd Health may engage trusted partners to assist with clinical reviews for certain health events like surgeries and major scheduled procedures, treatments, etc. These clinical reviews help ensure high-quality outcomes for members at the best value to the crowd. Clinical review services include, but are not limited to, clinical and medical appropriateness reviews, evaluating a health event for eligibility under the terms of Crowd Health membership, and remote second opinions. If Crowd Health engages a third party to review your event, you will be notified by their care advocacy team. Self-disclosed medical history is treated as an aspect of a member's medical record and is subject to clinical review. Costs related to clinical reviews are considered part of the health event costs and are eligible for crowdfunding. Specialized negotiation support. Crowd Health may engage trusted partners to provide specialized negotiation support for certain health events. This negotiation support is performed on behalf of the crowd to assist in negotiating fair and reasonable charges for member health events. These pre- and post-events negotiation services help ensure the Crowd Health members are not overbilled for care and that the crowd's funds are maximized for the benefit of all members. If Crowd Health engages our partners to assist in negotiating your event, you will be notified by the Care Advocacy Team. It is the member's responsibility to respond to the Crowd Health team and negotiation partners regarding information, updates, and action related to bill negotiation. If a member is unresponsive in the negotiating process, including an unwillingness to explore reasonable discount options and/or if a member fails to take advantage of a negotiated discount during a negotiated time period resulting in a loss of discount, the bill's health cost score may be impacted. Because all bills remain the responsibility of the member, there may be a rare scenario where a paid bill is negotiated to a lower price after crowdfunding, resulting in a refund to the member. In this case, the member must, in good faith, return any refunded money to the crowd to be used for crowdfunding other members' health events. Costs related to negotiation services are considered part of the health event costs and are eligible for crowdfunding. Crowdfunding account management. Each month, your membership fee comes to Crowd Health, and your crowdfunding flows through a crowdfunding bank account to fund other members' bills. Your crowdfunding participation voluntarily funds medical bills for the crowd. When other members fund your bills, the crowdfunding will be transferred to your crowdfunding bank account. Missed membership fee payments. To maintain an active Crowd Health membership, members must keep monthly membership fee payments current. If you fail to pay your monthly membership fee on time, you will be notified and your membership will become inactive as of the day of the failed payment. Membership accounts with unpaid membership fee balances after 21 days will be terminated and subject to terms of cancellation. Members who miss crowdfunding requests because of a temporary suspended account status may be asked to make up crowdfunding by receiving additional requests that month. Now, canceling your membership. You may cancel your membership at any time. Cancellations are effective at the end of your current billing cycle. You must cancel 10 days prior to your next billing date to avoid being charged for the next month of your membership. If you decide to leave and want to rejoin Crowd Health later, there is a minimum waiting period of 6 months, 180 days, between your cancellation and the start of your new membership. If you cancel your Crowd Health membership and decide to rejoin later, your previous generosity score will carry over to your new membership. Please note, for your expenses, to be eligible for crowdfunding, you must be an active member both at the time the expense is incurred and at the time the expense is sent to the Crowd Health funding. Here is the member manifesto. 1. I understand that Crowd Health is not insurance, and I think that's a good thing. 2. I have fully read and understand this membership guide that describes my Crowd Health membership and how it will help me pay for my healthcare costs, including my $500 member commitment for each health event and the specified limitations and exclusions set forth herein. 3. I understand that for my membership to remain active, I must keep my monthly membership fee payments current. 4. I understand that my participation in the crowdfunding of the community's medical costs is voluntary, but my participation in funding others' bills affect my generosity score. 5. I understand that my health visits, except for unplanned urgent or emergency care, should be initiated through the Crowd Health platform, or they may not be eligible for crowdfunding. 5A. I understand that the ability to negotiate on my behalf as a self-pay patient is an important part of how Crowd Health operates, so I agree to let my providers know I am a self-pay, uninsured patient at each appointment. 5B. If a medical practitioner of my choice bills me an unfair amount and is unwilling to negotiate, I give Crowd Health the right to pursue legal action against the provider on my behalf. 6. I understand that both the crowd and I benefit when members make smart, mindful health and healthcare spending decisions. 6A. To care for myself and my fellow crowd members, I commit to maintaining a healthy lifestyle, including abstaining from any illegal drug use or activities. And 6B. To uphold the integrity of the crowdfunding process on behalf of the crowd, I commit to not knowingly or repeatedly visit a medical practitioner who is unreasonable or unfair in their billing rates and practices. So, ladies and gentlemen, I just read to you the entire membership guide. It's a lot to read. And who reads everything, am I right? Well, I just did. So I did it for myself, so I know all the specific details because I read it for a purpose to make this video. And then I did it for you so that if you want to learn about crowd health, you can play this in the car or something. You can listen to it. It's a lot easier to listen than to read for a lot of people. And make a decision if you'd like to join crowd health. I joined. My monthly insurance bill went up to $907 just for me. I'm a retired public middle school teacher. My insurance with the school board for Aetna went up almost $100 from last year, $100 from the year before when I retired. And I expect it to continue to go up $100 every year. So I would now be paying $907 a month. And now I'm only paying $50 a month and as much as $275 if they ask me. And they didn't ask me for that much last month. So it's based on the needs of the crowd health community. So I am saving over $700 a month so far, which adds up to over $7,000 a year I'll be saving. So far, I'm very pleased. I'm motivated to stay healthy, continue with my carnivore way of eating, and exercising and riding my bicycle and lifting and working out and watching and making sure I don't have any accidents. I want to make sure I don't ever have to use this for accidents or for any other medical reasons. Of course, I'm going to go see my doctor in July or August of this coming year for my well care visit. And I read all about that. I know that they will pay up to $300 of that. So check out Crowd Health and make a decision. It's a completely new concept. And I think that our whole country should jump on board, to be honest with you. This is John Laspina, the carnivore teacher, signing out. Take care.